All right, we are here today as a follow-up to the 988 webinar we did back at the start of this year. And we're going to be talking about what's different now, any clarifications and questions we didn't get to answer at that time. I'm here with Rob, Emily, and Jess. Can you each take a minute just to introduce yourself, maybe starting with Rob?
Yeah, hi. It's great to see everybody and have an opportunity to answer some of these questions together too. So I'm Rob Wipond. I'm a freelance investigative journalist and who's been looking a lot at 988 over the years, and also author of a book, Your Consent is Not Required: The Rise in Psychiatric Detentions, Forced Treatment, and Abusive Guardianships.
Great. And of course, we just did a webinar with you on your book that is also available on our YouTube channel. So thank you for that. Emily?
Hi everyone, my name is Emily Truong. I'm a new board member for the National Coalition for Mental Health Recovery. I just went to DC with them in early June. So with other psychiatric survivors, saying things like, hey, if elder abuse is a crime, then why isn't patient abuse a crime? And the system just doesn't have a place for this kind of abuse. So so I'm really happy to be here as a follow-up to the January conversation we had about 988, because the system needs a lot of work. Thanks for having me.
Thanks, Emily. And I think you met two of my coworkers, Earl and Liz, in DC in June as well. And Jess, I actually introduced someone on a panel yesterday by saying that they were highly recommended by one of my favorite people in the suicide and peer support space, which was you.
That's some high praise. I am Jess Stohlman-Rainey, and I work in sort of the crisis space, where peer support and crisis work intersect. I'm really interested in sort of suicide and how that gets like both like managed by and how people are supported through the systems that exist, how they're not supported, and how they're managed more often, things like that. I do research. I work with crisis systems through my consulting company, and I also do direct service peer support and death doula work, all as a part of my like lots of small hats that I like to wear. And I'm currently working with a number of crisis centers and states that are building systems connected to and supporting 988.
Great. Thank you, Jess. All right. So for all of you, I have questions that people from the past webinar had asked, and then I have a couple of questions myself, but I was wondering if we could just start with a broad sort of each of you take a few minutes and talk about, like, are there any key new developments in your life, in your work, or things you want to name with 988, or even things that you feel like you were thinking about from the webinar we did in January, and you're like, well, I didn't quite say what I wanted to say about that, but I want to share this now. So anything in that category, does that sound okay with everyone? All right. Jess, maybe go in reverse order.
Yeah, we can do that. So I think I'm gonna just talk about some things from a systems kind of perspective, I think, just as I because I'm close to that. Um, some of the things that happen around this time of year is that we're on if you're on a government calendar, this is when recontracting happens. So through the spring, there are requests for proposals for for organizations to work in different government subcontracts or contracts. And what that means for the crisis systems is that many of them have new providers. And when a system is new or what is growing really rapidly, we often see some churn around changing providers over and over. And some of what the call centers who are previously providing the lifeline were worried about is that some of these bigger organizations that have a lot of capacity and money are going to start sort of gobbling up these 988 contracts, and that's exactly what is happening. 988 is becoming much more corporate. Crisis response is becoming much more corporate. Um, there are lots of ways to look at what that means. One of them is that the people who pick up the phone call for you may or may not be local to you. One of them is that even if the people who pick up the phone calls are local to you, their boss probably isn't, and their boss's boss probably isn't. And you know, as we become more corporate in our approach to crisis work, people start looking a little bit more like numbers, and our ability to respond and react to things on the ground it declines. And so I'm someone who's pretty opposed to this kind of network evolving, and so are most of the people who have worked in the crisis industry for a long time. But it is happening, and it's a really complicated time, I think, for people who are providing services. What that means for the people who are on the other end is, like, you maybe experienced a time where the previous provider of the phone calls was no longer working, and another system had to start. There's a changeover point. So you might have experienced a time where you were unable to get through, unable to get calls in. You were going to backup centers, things like that. All of the institutional knowledge about how we provide this service has changed. You may be someone who calls these lines on a regular basis, and you're getting an entirely different service now from an entirely different organization that may or may not be more restrictive in their approaches. The bigger an organization is, the more restrictive it tends to be in their approach to working with people. And by restrictive, I mean they are more likely to use interventions against your will or without consent. That sort of changed in that I am aware of, and it makes me really concerned for some of the future of 988.
I have so many questions, but we'll come back to that. So Emily?
It's hard to sum up all of the things I've been active in the past 6 months, on top of a family member being in the hospital as in and out for the first half of this year, and then me driving her to the ER 2 out of 3 of the times she had to go to the ER, and it was like in the back of my mind, you know, I have to keep this crying face hidden because I'm being re-traumatized, thinking about my experience in the back of my mind while I'm being at the front lines without the tears, ready to go for my mom. And but even through the experience, the nurses were kind to me because I told her these were my experiences, and my mom would say, stop talking to them about your terrible experience. And I had to say to my mom, they're helping you physically, where they're helping me mentally, because they're validating my experience, and they're all saying you should not have experienced such mistreatment in the hospital. That's not cool, what those nurses did to you. And so it's just, you know, I even though I'm still have to go up to bat for other family members while I'm still working on healing and advocating for myself, and, you know, went to California Department of Managed Healthcare Services, and then they told me you have to withdraw your complaint, and you actually have to go to the California Department of Public Health to report on how you were mistreated inside the hospitals. And then it took 11 months for me to finally get like the USC Arcadia hospital off my back for the bills. They even had it go to like my text message saying, oh, this is the collection agency and you owe this much money. It's like, hello, in March, didn't you tell me that it would go to 0? Why did it have to take another few months for it to finally be at 0 and that I would have no owing. It's like, I told them why over the phone. I'm like, there's just so many details, and I could share so much more, but I don't want to take over the conversation. So I guess another few things that happened besides that was I was part of a Taiwanese American mental health conference just 2 weekends ago, and which was endorsed by the current president of Taiwan. And even Taiwanese politicians were at this conference as well. And even though I couldn't understand everything because I'm American born Taiwanese, so my Taiwanese, my Mandarin Chinese is not super fluent for me to understand every single word they're saying at this conference. So like but still, even at this conference, I made a connection to like the former president of Taiwan, who's still alive today, because I wrote him a letter in June 2013. Please don't kill yourself. Please don't kill yourself. You're someone who is such an important person to the Taiwanese democracy, for people feeling like they have a voice. And so I feel like my advocacy skills have kind of come, from my cultural roots in a way. It's just like Taiwan is trying to wants self-determination, and many people do. So do children who want to have a voice, but they're a minor and their parents don't listen to them. And then a child goes missing for several days because she thinks her mom is the devil. Like we have a missing child who in my neighborhood, and but she's found. And but it's just absurd to hear stories where like mothers are want to send their own child to a mental institution while they're in a child custody battle. I'm like, what the hell's going on? But anyways, I digress. And on May 31st, I got the 2024 Community Champion Award from Senator Anthony Portantino just before I went to Washington, D.C. With the National Coalition for Mental Health Recovery, and telling them, hey, if senior abuse is a crime, then why isn't patient abuse a crime? Why aren't we looking at these laws, outdated laws that where law enforcement are not being trained properly to handle these kinds of situations? And so I'm always trying to find where places where my voice will be heard and valued, but sometimes I still sometimes feel like my voice has fallen on deaf ears. And even with the Arcadia PD, can't get them to show me what happened that night through body cam footage. So it's like I almost wish I did put my camera up and recorded the entire experience, and I feel regretful that I don't have that. And so it's just so many mixed feelings throughout the last 6 months. So, and I'll close here. Thank you.
Thanks, Emily, and I appreciate your vulnerability and willingness to share, and also congratulations on the Champion Award. Rob?
Yeah, and thank you, Emily. Good reminder, right? Also of just the personal impact of these kind of policies and practices that 988 can have. So those are some of the latest developments for me. Emily's in an article that I researched and wrote, and I ended up writing 2 articles for madinamerica.com around issues that do bring some new data and new information to this. In particular, we have a study done by NRI, the research arm of the National Association of State Mental Health Program Directors, which was a survey done not even only of 988 lines actually, but of hundreds of other crisis lines as well around the country. So it's very interesting data, and from it we can see that it looks like policing interventions, and I include there also first responders like fire department and ambulance services with police. But those kinds of emergency interventions that we've all been concerned about have gone up, and they've gone up a lot. So in the first year in 2022, up from an estimated 1 to 2%, they used to say publicly, and these numbers arrived at about 7.8%. So really dramatic increase. And along with the increases in the numbers of calls to 988 prior to the institution of 988, to the National Suicide Prevention Lifeline, the overall number of people has gone up even more. So now affecting about 390,000 people per year being subjected to these kinds of forced interventions, usually forced. You know, the data is a little unclear within that, how many people are consenting, but in our last conversation, we know that even that's a very amorphous thing. Like if we look at Emily's case, it looks like she might have been recorded as consenting because she had, without knowing at the time the implications, she had disclosed her location to the 988 operator, and ultimately was detained against her will. So how is that recorded in their data system? So yeah, we see these going up a lot, and so that's one. And then the other piece of it that I started to look into more robustly was the question of what's going on with the actual conversation recordings, and found that it looks like lots of call centers and Vibrant Emotional Health itself are sharing this data. They may be charging for it. I'll say that I submitted 16 detailed questions to SAMHSA as well as Vibrant Emotional Health. They refused to answer all of them. They didn't answer a single one. They gave me a kind of generic general response. Oh, we care about people's privacy, blah, blah, blah. But essentially what we find is that this information looks like it's being widely shared, that there's corporations directly involved. And this goes to what Jess was just talking about momentarily. There's more and more large corporations moving into this space. And so they're directly running a 988 line and then siphoning those recorded conversations to use in all these ways that they're not disclosing. The privacy policies that I looked at, they're all over the map, which is something we also discussed last time. Jess said, I think a lot of these groups don't even know what they're doing or whatever. I don't want to put words in your mouth, but it was something to that effect that she was saying, I think they don't really know yet what they're doing. And that seems to be the case. Like, the overall privacy policy for 988 as a system seems really sparse, and it's not even clear that it's enforced at all. And then every individual call center seems to have its own, and they almost never address the question of what they're doing with these recorded conversations. And it looks like they're being used to develop artificial intelligence systems of different kinds and all sorts of other research, some of which I found out about, details about, and lots that we don't know anything about, and that these groups don't want to talk about, these organizations and agencies, which is really disturbing. So those are the two kind of big areas, which we'll undoubtedly return to, and some of the questions that people have asked. But for me, it's pretty important. And I do want to say one more thing. So we've had the 2-year anniversary of 988 just happened this week. And I was on the press call. So I managed to actually get a question in there where I just highlighted this particular research about the 4-fold increase in these policing interventions, so that other media would hear about it, and I cited the study so that they could go find it. And so far, I have not seen a single news media outlet, though it's been widely reported, no celebrating the 2-year anniversary of 988. I haven't seen a single one that's actually mentioned this, which is crucial because it was really how 988 was sold to the public. We're going to reduce policing interventions, and instead they've gone up, and they've gone up dramatically. So it should be part of the public discussion. And so far, it's looking like news media are just playing along with SAMHSA and Vibrant and NAMI as part of this, where they're just not disclosing that at all. They're not discussing it at all.
Thanks, Rob. And I think it's probably too soon to have this data as sort of a comparator, but I'm super curious too where the suicide rates are like most recently at, because in theory, right, if we now have 988, we're spending millions and millions of dollars on 988, and as much as we disagree with the force, many people will see it as like, well, there were all these interventions that stopped people from hurting themselves, right? So I'd love to know, like, where is this actual suicide rate? Now, that data tends to run a few years behind, but I'll be curious what it shows us when that starts to emerge. And, you know, not that it's even necessarily, that data's never quite right, you know, like where are we actually getting it? But I'll be curious what they find that it's saying. Do any of you, I see you're unmuted, Jess, do you have something to add with that?
I'm
about
looking
this?
at the 2023 suicide data right now, the provisional data. And oh wait, no, it's not showing up. 2022 provisional data, and rates are pretty consistently the same and higher in some ways than 2021 to 2018.
Right.
For
I think it'll be
suicide,
super telling when we get to like 23, 24, and we're seeing
yeah.
all this stuff go up and like what's the actual impact? Not that it's even necessarily
Yeah.
a direct causal thing, but it will be interesting information.
Yeah.
So I did actually want to ask you all though, based on what what you're saying and what you're seeing with 988, I'm curious, and you kind of started to get at this, Rob, like how that compares to what the media is saying, and specifically CNN. I want to read what they said in 2023 versus what they said in 2024. In 2023, I think it was an October article, there was a sentence in there, a couple sentences that said, but overall, only a quarter of people said they would be very likely to turn to 988 in the future if they or a loved one were experiencing a mental health crisis or suicidality, and less than a third of people with severe psychological distress who had already tried the Lifeline were very likely to use it again. Now, that was a pretty powerful statement about how people were responding. However, just this month in July 2024, they published an article that said, the poll showed 72% of Americans said they are comfortable contacting the Lifeline. Of those who had contacted 988 this year or whose loved one had done so, nearly 7 in 10 said they had received some or all of the help they needed. This sentiment is up 55% from June 23, according to NAMI. So they're getting this data from NAMI. And I don't know where NAMI's getting it. Do you have thoughts, any of you, on that?
So, I gotta say, I'm not entirely surprised that that previous study, the ultimate number of people who'd actually called 988 was relatively small overall. So it was very damning numbers, yes. But, I'm not entirely surprised because, generally speaking, the majority of people who call these crisis lines overall do get a conversation out of it, and they can feel a little better. Like, I wouldn't be surprised that, like, we've seen that sort of historically, that generally speaking, a well organized and line with good people staffing it, and they'll have nice conversations with people overall, and so there'll be that kind of rough majority overall that sort of say, yeah, I'm glad they were there. I'd almost say it's kind of like the worried well are getting a nice experience. But people who are really having serious trouble or disclose in some way that they are in the moment, they tend to speak more dramatically or in whatever way, are likely to end up having a much worse experience. And they're kind of being hidden already in this data. Like, oh, it doesn't matter then. It doesn't matter if 10% of those people are actually having life-changing negative experiences that are totally traumatizing, because if 80% or whatever that number was, right, but if a large majority are saying, hey, I had an okay time, then we can just ignore them. And that's why I object to these kinds of studies in a way, because I think we know this. We know that a crisis line is a nice thing to have, and often people get something of value from it. What I really object to too is then linking that to life-saving, because no, we don't have that link. There's no study that shows if you have a nice conversation on a Lifeline, your life has been saved, right? And so, that's a stretch. To say that you felt a little better that day for a little while, yeah, I believe that. I'm not surprised to hear it.
I think I would say some similar things, and then like a couple of like specific, like drilling down into some specific other things. So one is um the first year of 988, there was not advertising. There was not a concerted advertising effort, but there was a dollar amount for advertising that was given as a part of the grant funding the following year. And so um it is not surprising that people's attitudes about something change when they're being advertised. So like that's one thing that I think is important. And then the second is that there is a pretty good body of research that says that like connection of any kind, like feeling connection is something that is helpful to people when they are suicidal. And like depending on the intensity of what you're experiencing, just connecting someone and getting to talk about stuff is going to be helpful for you. And so like I think that's a great thing. It's like great that we can offer that to people. And so those folks are yeah, having a good experience. And I think anyone who is like presenting on those lines in a challenging way is having a really different experience. And I mean challenging for the person taking the call in that they feel like they don't have control. They feel scared for the person. They feel attacked because the person is angry. Any of those kinds of feelings that a call taker is having are going to result in some worse outcomes for the person that's calling. We also are looking at like, you know, we're a little bit farther in. And so there might be some people who are a little bit more seasoned at crisis work picking up calls now, meaning they've maybe got 6 months to a year under their belt at picking up crisis calls. Although the turnover is pretty high in almost every setting. There's some of the call centers have turnover rates that are in the 90% range, like really, really high. So, and depending on how you look at turnover, that's complicated, but yeah. So like, I think that as a service goes on for longer, people are more likely to say they would refer to it. And people are more likely to have used it, had some kind of experience that was maybe helpful. And you're probably less likely to fill out a survey about 988 if the cops were called on you and you had all these experiences, right? Like oftentimes satisfaction surveys that you do for like a hotline come at the end of the call. And if they called 911 on me, that end of the call looks a lot different than if I stayed on the line and talked to someone and then they send me to a survey and I say, yeah, they did a great job.
Yeah, there's all these other, I think, complicating factors in there, like if people don't know to expect something different, then they're satisfied with what they get. You know, so I think there's all these low level problems or lower level than the force problems, like, and we talked about this some last time, like how they respond to self-injury, at least in my experience so far, has been pretty poor. But if people don't know that they should be getting a different response, if they've internalized the typical response, then it's going to be kind of satisfactory. I had a similar conversation with a Boston Globe journalist who's like, well, you know, this parent I spoke with thinks that this is the right choice for his son, and it was something to do with force, right? But if that parent's only been told that it's either force or nothing, then, you know, that might be what he says needs to happen. So I don't even know how to begin to pull apart that. And then if we add in the reality that people are likely to lie on those surveys and say they're more satisfied than they are, you know, I just, on top of what you all have also said about the reasons they might actually be satisfied, I don't know that we'll ever really be able to get an accurate picture with that or anything else, really.
Well, the other quick thing I want to add, sorry, Emily, I'll just quickly add this, was just that, you know, the other data we did get shows that it's actually a relatively small percentage of people who are calling with suicidal feelings. So 70–80% often are calling to get referrals to local, you know, agencies of some kind, like what's there in terms of supports, or they're calling to just kind of discuss work stresses they're having or relationship issues and things like that. So those might be the people who are feeling satisfied because they're not actually needing a lot or demanding a lot. And so we really need to look at the data. What about the people who are really calling with serious issues, right? And this is getting kind of lost in that data.
Thank you. Emily?
One thing I forgot to mention earlier was that I got to speak to Senator Alex Padilla's staffer in Washington, D.C. in early June. It's now late July now. I didn't follow up, but I still remember his reaction changed when he's made it sound like, you know, because Alex Padilla was so gung-ho about 988, he mentioned to me, Andrew Wagner, and another lady, Anya Baroff with our team. She asked him, okay, so he said that he had received some kind of statistic that 97% of all 988 calls are successful in that they prevent people from wanting to kill themselves or something like that. Like that was what I took from what he said. And then Andrea was like, where is your research from? Where did you get this statistic? And like he didn't really answer. And so I wanted to follow up with him, but just have too many things going on in my own life that I just haven't gotten around to it. So but once I started telling my story to him, his facial expression completely changed, and then the meeting had to end. So
Thanks for, yeah, I appreciate that you're continuing to push on people on these rules. Can I just ask you, while we're talking about your experience, Emily, quickly, there were some people after the first webinar that said, well, I'm confused. Was it the security guard that made her go to the hospital? Was it 988? Did 988 call the security guard? Can you just briefly explain that piece for people who were confused?
yeah, so what happened was I called 988 because it was around midnight. I initially wanted to be anonymous because I didn't want to call my friends and disturb them. And, you know, because in the Asian culture, sometimes when you just, sometimes it's hard to know who can really handle your crying over the phone. So late at night, and so I ended up like, okay, 988 ended up, I told the 988 person that I see a security guard, and eventually he told me, give your phone to the security guard. I don't know what was said, and then the I believe that the security guard called 911 on me. So and then the fire department people showed up first before I saw the police. The fire department personnel talked to me casually, but none of them were women. No female energy to, you know, because men are like known for like being quick to fix, quick to just action, action, action. Whereas like women sometimes are much more like, okay, let's assess this. Like, and they're much more compassionate with their emotions and being in touch. Yeah, so I think that was lacking. You know, we don't have enough women or females working in law enforcement. As you know, because men are like seen as, oh, we have to always have the answers, and even if we don't know the answers, we just keep on going and make fuzz, you know, just make it along as we go. That's what it felt like they were doing the night of my 5150.
So ultimately, though, it sounds like it's a little unclear what 988 instructed the security guard to do, but ultimately you ended up, yeah. Well, thank you for sharing that. So I'm wondering if you all would be able to provide a, an update on what you know about geolocation. It's coming up all over the place. People are still using very interchangeably geolocation that routes calls versus geolocation that finds an individual. And there were actually quite a few questions in what came through and what I've heard since, people just really trying to understand what's going on, and including if some areas might be using geolocation already in a more directed way than the national message. Any of you, Jess or Rob, I know you both have information on this. I don't know who wants to jump in.
Definitely there are some places that use it already. Often it's through law enforcement. So like in their relationship If you have a contract for providing 988 services, you're required to have a relationship with law enforcement. It's explicit that you have sort of that relationship built out. Depending on the law enforcement agency that you're in that contract with, they might have that service available. So often this has been happening for a long time is that the law enforcement agency is who does the geolocation. In some places, law enforcement doesn't think that it's legal. So I know of specific law enforcement agencies that don't think it is legal to use geolocation specifically for this purpose. Some do think it's legal. It's interesting. The more libertarian the space you're in is, the more likely they are to think it's legal, has been my sort of that's been my experience. I don't know if that's exactly accurate, but that's something I'm noticing is that in a lot of spaces where people's politics look that way, we're less likely to see those kinds of interventions used. There are organizations that have the capacity to do it on their own also already for other purposes. And so they might be using it, but it's definitely something that within the field, a lot of people think is a good idea. And then a lot of people who directly provide the service don't. So it's really hotly contested. And so you even might see within an organization, individual people who would be willing to use it if they had it or if they have it right now, and other people who just never will. And so it's really interesting how that is evolving to me. But definitely it exists. It is not the majority of places, and it's not broadly used throughout the system at this point.
But is it even in through the police direction? Is it your impression it's not broadly used as of yet?
I mean, yeah, like I guess it depends on what we mean by broadly used. I guess I would, this is complicated. So I think in the cases where people are calling 911, law enforcement, if they have the capacity to do it, they're going to do it probably. If they believe that it's legal and they have the capacity. I don't think it is not my impression that most places have the ability to do it. It is an extremely expensive service that maybe your law enforcement organization got a grant or some other kind of dollars for. But it's not typical that they have access to it in that way.
Bob?
Yeah, so it kind of depends how we're defining who's doing what exactly. What we saw from the NRI study is, yeah, there are some states, and it was all anonymous. They granted anonymity to these states, so that's important too. But it was all over the map. So we saw really high rates of these kinds of policing interventions in some places and much lower rates in others, and so on and so forth. And that probably varies even from call center to call center a lot, and even from person to person within the call center. What we know is that by law, they have to actually have the capacity to do it. And by that, I mean the capacity to contact 911 and make a request that they do it. And in most cases, that capacity exists within the public safety answering point. Whether or not that will work on every phone and in every situation, no, that's still really hazy. Like they're aiming for standards all the time. So, and we just don't have the data to really say. What we know is that kind of intervening has gone up, and it's gone up a lot overall. So that's a relevant piece of this. The other piece, though, yes, directly, we've got two issues kind of before us. One is geo-routing and the other is geolocation. So right now, the FTC, I think it is overseeing a process where they're trying to basically bring in, they're getting public input into the question of bringing in geo-routing, which would be when you call, they would utilize the exact location. And this is important. In order to make it work, they need to know your exact location. And they will use that exact location to route you to the nearest call center. But that information will then be theoretically suppressed. The call attendant wouldn't see it. It's just happening in the exchange, the telephone exchange, as it were. And so that's what we're close to getting, because there's very, very little public resistance to it. One of the issues that have been raised is, hey, that information should be suppressed. So it shouldn't be disclosed. A geo-routing should not become geolocating, where everything about a person and their location gets automatically disclosed. Problem is, you need to do the first thing to get the second thing. And so, yes, the FTC and FCC have agreed in principle, saying that's right, it should be disclosed in principle, it should be hidden in principle. But we already have lots of examples on the books of that information actually being recorded, stored, shared, sold, enormous amounts of money being made, all sorts of really bad events happening as a result of everything from a little small town sheriff getting access to that, not with 988 specifically, I'll say with 911, well, not even with 911, just with this kind of precise location data being stored by providers. So Verizon and AT&T and these kinds of agencies have been storing and selling that information, not really regulating it in the way they were supposed to. And so we have examples like that going back a decade that have kind of hit the news of sort of this being done in a very systemic way, and then also in these one-off cases that are really dangerous. So I just want to highlight that this risk exists. As soon as we're geo-routing in 988, now we're storing that exact precise geolocation moment in a database somewhere. And will it be deleted? When will it be deleted? Who will it be shared with? All of that has yet to be ironed out. So that's a real concern as well in all of this. And then the other piece of it is we know, as Jess said, that yes, some call centers are already actually able to do it themselves. So when 988 says, we can't do this ourselves, only 911 can do it, they're lying. Because we know that there are some call centers that have actually admitted we can do this. And Rapid Deploy is a software tool that's been developed in order to circumvent the limitation that exists and basically patch the 988 operator into the 911 system. Right now, it's supposedly opt-in, but they didn't answer any of my questions. They refused to talk at all. The Rapid Deploy, the states where I knew that they were actually using Rapid Deploy refused to talk to me, the 988 call centers. So who else is using this? What are they actually doing with it? You know, is it really opt-in right now even, or are they actually using it to do forced interventions? We don't know. It's all being hidden. But we do know that, yes, I think it was another study found that some of these call centers are basically integrated. So the 988 and the 911 folk are sitting side by side or near side by side in the same office. So essentially they have kind of the same accesses that each other have, or a very easy route to doing it. So what does that mean then if we say, well, 988 doesn't do it, 911, not, you know, we don't do it, but the guy sitting next to me right here, he does it. He's with 911. You know, that's essentially what's happening in some places. So yeah, they have the capacity, and there's really no regulating of this going on because there isn't a unified policy. There's no, as Jess was highlighting, there's no clear law around this. It may even arguably be illegal, in fact, that they do this at all, but it's never been tested in court, to my knowledge, anywhere. So, but it's spreading and it's expanding for sure.
So one thing is the language. So a lot of people, even as recently as yesterday's panel, are referring to the geo-routing as geolocating. It's just a form of geolocating. So people are using that umbrella term. So it's getting confusing, I imagine, for the public. Like, what are we actually talking about? I personally have been thinking of geolocating as the umbrella and then geo-routing as a part of that. And maybe that's not right, but that's how I've been hearing it used. So I'm curious if you have any thoughts on the importance of naming things correctly. And then the other piece is I'm just interested to know your thoughts on that. Like when I was at CrisisCon last November, a marketer of geolocation that was essentially geo-routing was basically saying that the geolocating, or that they're doing, the geo-routing basically is not getting a precise location. It's getting like a 2-mile radius or something like that. But what you're saying is different than that.
Yeah, so what was clarified to me technically is that in order to identify where your nearest call center is, I got to identify exactly where you are. And then we can route you to the nearest call center. And so if I'm a call attendant at 988, I don't need to see any of that necessarily. And in the way it's being laid out, I won't see it. It will just happen. But the point is, my call provider or the system that I was being routed through will know that. They will have that detail, the best that they can do essentially at the time, whatever that may be, right? Based on the phone I'm using and the call provider's own, technical capacity and everything else. But generally overall, across America, we're moving towards increasing precision. So in principle, geolocation will occur. that data will be used to route me to the nearest call center, but it will be hidden or suppressed. However, as a data point, it still exists. And this is what was highlighted to me by the Electronic Privacy Information Center, who've weighed in on this, like with a formal letter to the FTC about it, saying, hey, you got to make sure that that data point, gets erased at some point in time. There's some protocols around this. The FTC agreed, but declined to actually do a regulation to say this data point must be removed within a certain amount of time. It should never be sold under any circumstances, blah, 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 blah. They just said, yeah, generally it should be, private, but
Right, so
really what's going to play out.
So in some ways, the person who's marketing it at these conferences is just kind of lying, because they're sort of talking about what the end product will be regardless of what's happening along the way, which perhaps is a tactic to avoid people from freaking out and not wanting their product.
Well,
I don't know.
exactly, because right now, what I can tell everyone is that in principle, and again, there's always this qualification of, if you're calling from in the mountains, it might be hard to locate you, right, or whatever. So that's always there. But generally, in principle, guess what? If you call 988, yes, there is now a permanent data record that you called 988 and exactly where you were and who you were when that happened. Now, will that be disclosed to 988 operator? At this point, it sounds like no. Okay, but will it be disclosed to your provider, right, that created the data point? Absolutely. Will they erase it? We don't know.
Jess, can you? Yeah, well, absolutely. Jess, can you offer a little bit more about organizational policy and law versus individual practice?
Yeah, so I think there's this what is it supposed to look like? And then what actually happens when people are taking calls, and it's sometimes they line up and sometimes they don't. But if a data point exists somewhere and a call taker knows that, there are usually ways you can get it. So if you are really scared, something happens in a call and you're really scared about someone as a call taker, and you believe like your set of beliefs says that we should do every single thing we can to stop someone from killing themselves, and a person is in a really bad place and they hang up on you, and you know that data point exists, you might do things like call law enforcement, ask law enforcement to call the mobile provider. Or maybe you work at a place that's also a community mental health center and you have that person's address if you access their file outside of the crisis system, which you shouldn't be doing because HIPAA should prevent those two things from talking to each other. But everybody builds in the same electronic health record. So guess what? You can. And so you look, or you call your friend who works in mobile crisis, and your mobile crisis friend has the information about where that person lives. And so you send cuffs there anyway. So there's the issue of geolocation, which I think is really important. And there are ways deleting information is extremely important. That getting rid of data that is people are not supposed to have access to really matters, because people will find it. And organizations will sell it. More than anything, organizations will sell it to make money. That's what they did. That's right. Your phone company is there to make money off of you. They're not there to help you. And so even nonprofits are only kind of there to help you, realistically, right? They're also businesses. And so that individual person or the supervisor, or maybe there's a law enforcement agent who's really gung-ho about this and is going to call, is going to make phone calls to AT&T, and they're going to talk to a customer, right? They just find the right person who's going to share data they're not supposed to, or they don't understand the law. Most people don't know that HIPAA should prevent them from looking in a different EHR system or a different set of records to be able to find someone's information, but it does. And so you see these small violations of policy that people really don't understand, because the law is complicated, the policy is complicated. What the result is that someone can die because police show up and they're in a place and they kill them, or there's all kinds of things that can happen that go awry in our individual practice, because the priority here is not based on the person's choice. It's based on suicide prevention. And we've literally lost the plot there in the sort of suicide prevention world, that we are supposed to be supporting and helping people who are experiencing suicide crisis, not just keeping people alive. that's not the, to me, that is not the point. And so because we've had this focus on we should just be able to keep people alive, we're doing all these things. Like, if we really believe that people want to live and they're accessing this service because of that, we wouldn't need geolocation, because we could just ask where people are and send someone to help them if they wanted it. And so if we believe people want it, then why don't we just do that? It's a whole lot cheaper. This is all based on this idea that people don't know what's good for them, right? And so when that is the basis of your system, or the basis of the way you're training people, teaching people, they're gonna do things to try and save a person that really push the boundaries of the law and the policy on their own as well.
Yeah, thank you, Jess. This panel that I moderated yesterday, one of the people from the American Foundation for Suicide Prevention, it's written into her bio, and she said it out loud to the audience that their job is to save people. And I do think like that's such a dangerous way to be operating, because it does drive exactly what you say, and it loses so much track of this reality. Like, I think a really well-proven reality at this point that loss of power and control in people's life is often what drives them to not want to be alive. And then when we're trying to save them, we're just taking more of it. One person asked if there's anything that people can do to their phones to avoid geolocation. Is there any way? Can either or anybody speak to that? Do any of you have any information?
Yeah, you can use a VPN and call from a different, from a different service, like a Google Voice number or something like that.
Can you just explain that a little bit more for people who might not understand what that all means?
Yeah, so a VPN is like a virtual private network. It'll look like you're calling from somewhere else than you are. And Google Voice is just a service you can set up. You can have there are all kinds of internet phones you can use. I would not be surprised if at some point some of those things start getting blocked from the system, if the goal is that we don't use them. Like, these things have been addressed, VPN specifically have been addressed as a big issue by 988 providers in the context of text and chat, is like, we can't find people because of those things. So like that, I think that's, yeah, I think there's a possibility that some of this would change, but yeah, you can use a VPN.
Right. And do either of you know if because you can go to their website, right, and chat with them. Does that give them, are they getting the internet address, and is that locating you still just as well?
Yes, it's better. It's a better.
Yeah, and I would not have the confidence that Jess is, like, to me, I think you know, and you can challenge me, Jess, on this if you disagree, but I'd say again, it's just an issue of, well, certain things you do might make it a little more difficult, you know, but no, you can't guarantee if you're using an electronic device today, there are ways to find you, you know, unless you're an absolute expert in this space. And even then, because these are built in, they're not things you can just shut down on your devices very easily. So I'd say certainly there are things you can do if you get onto the utilizing internet based tools and use multiple layers, you know, you're using Tor, using a VPN, you're going through Google Voice, whatever it is. And you know, it's probably going to be harder to find you, and it might, but you should never do any of that stuff. And even, you know, if you go to Tor's website, or you go to any of these expert level websites that are dealing with security, they say never risk your life based on any of these security tools actually working. And that's what I would say to people. Like, definitely, if you know what you're doing, you can build some hurdles there, but don't count on them if it's a question where you're going, hey, if I do get caught, this could be the worst experience of my life, which is what a lot of people say. So I'd say keep that in mind. And no, I'd say better look for an alternative provider to call that doesn't trace calls, because some do exist. And if, you know, if you're ready to go to that extreme to avoid it, then don't be calling 988 at all. And they're going to get better and better at it. This is going to get more and more efficient. So even what we're saying now, 6 months from now, they're going to have ways around it, I'm sure.
Yeah, I would agree with you. I think I think it is much less likely, if you're doing things like VPN and Google Voice, it is much less likely that someone's going to find you. You know, if you're doing that, you can also do things like talk about some of the stuff differently that makes it less likely that someone's going to send people to you. Like you can say, I'm not going to kill myself, even though you are, like that kind of stuff. Like, so, but then if you're doing all of that, like, are you really getting the support that you need? I'm not really sure. It sucks to have to feel like you have to do those layers of things in order to protect yourself. And ideally you could go to a different service, and there's just a dearth of services is the thing. Like, that's why people are in crisis all the time. So so it's really it's complicated, and like if you know what you need is just to be able to like word vomit at someone and they need to listen to you, you can do some things to protect yourself some, and you should always know that there's risk. Always know that there's risk. And they are definitely getting better at it over time. Like every technology is rapidly outpacing any like ability that we have to track any of that stuff. So yeah, complicated. And like if you're concerned about your privacy, you should just be concerned about your privacy. So it's yeah. One thing I would mention about chat is like chat services, the capacity that they have for information gathering is much more significant than phone services, and more than text even. Also, like if you're using a chat service and you type some things into the chat and then delete them and you haven't sent them yet, they can probably see what you're typing before you send it, for example. Things like that. So like there's less privacy even there. So I think that's worth noting. And that's been true for a long time, since like, you know, AOL days. So yeah, depending on how it's structured or set up at the call center that you're using, then or the how 988 has it set up, it's yeah, complicated, and there's a lot of ways that your privacy is sort of always being violated when you're using these services in ways that you don't even know.
All right, we have there's so many questions that would be great to ask, and I know we're starting to like we're down to 40 minutes, I think. But one question that got my attention, in part because I'm just not personally familiar with them, but perhaps you are. Someone asked about the Electronic Frontier Foundation and if they've taken an interest in 988 and some of the privacy issues that have been surfacing.
I love the EFF. I don't think that they have. But yeah, if you're I highly recommend their website if you're looking at thinking about privacy related issues. I am not aware of any way that they've been involved in anything related to 988, but that doesn't mean that they're not. I would like them to be. Um, it would be really great if that was happening. But Rob, do you know anything?
Yeah, you know, I like Electronic Frontier Foundation a lot. And yes, I reached out to them. They had somebody comment on the very first article I did some time ago, and then this time as well, most recently, they did assign someone to have a conversation with me. He's in my recent article for Mad in America, you know, and I know that he had consulted at various points other lawyers within the organization, so they're aware of it. But yeah, I didn't get the sense that it's really, you know, a hot topic for them. On the other hand, Electronic Privacy Information Center has really picked up the ball on this. They really care. They've had multiple lawyers talking with me about it. We're doing some collaboration now too. So yeah, I'm impressed, and I'm hopeful that they may really step into this space. They're concerned about almost all the same things that we're concerned about, and they've been educating themselves on these issues a lot.
So there's some hope there. All right, so for all of you, there were a few questions I've seen in what got submitted back in January, and from what I've heard from others too, is like, why don't more people care overall? So Emily, you're talking to lots of legislators, and then others are saying, you know, what would it take to, does NAMI know? Does the American Foundation for Suicide Prevention, which has been such a big champion of pushing 988 legislation, do they know how many people are being harmed? And if they did know, you know, why would they care? And if they do know, why don't they care? And what do we need to be doing to get their attention on this? Any thoughts on that?
I think I have a love-hate relationship with NAMI. Because about, a year ago in August, I was given the platform for 15 minutes to do a plenary. And like when it came, like within 1 month of my 5150, I had the choice whether to talk about my 5150 that was caused by 988, or do I talk about my father to honor him on the anniversary of him going unconscious, which was also the same day I did call 988. Another occasion when I called, when, the crisis counselor basically said they cannot do self-disclosure like peers do. Peers are hired in the mental health system to be able to relate and resonate with the patients that come in so that they don't feel emotionally alone. And that's the power of peers and the support groups that we run. And it's just like, it's such a shame that 988 cannot operate the same way that the peers in the mental health system have been operating for such a long time, but is a newer role in the mental health care system overall. And it's like SAMHSA, Basila, and they're all saying that, oh, we peers are so important, but then why don't they even give us a seat at the table? Why don't they, and I tried to contact someone high up in NAMI National, just before she did her SAMHSA webinar, and she met me once in person in DC last year, but she's not responding, because it's like, I think they're basically being paid as contractors to promote 988, and even the county is too. It's like everyone is. But it's just like, yeah, I got hired as a contractor for LA County Department of Health, and it just, in my heart, it's like, I don't like promoting these materials that say 988 on it, because I know what I experience. And even NAMI, like my local NAMI, is, they told me like, you have a special case. So even though, we tried to do over the last 10 years, they, built up a relationship with our local LA County Sheriff's Department. And I used to be involved in those crisis intervention trainings, and where a family member and a peer would tell their story in front of a bunch of law enforcement. But then because of the pandemic, it stopped all of those in-person trainings. And I feel like just cops have a bad reputation. There's no cultural sensitivity training. There's no cops are taught to just exert their dominance, and they may even talk over residents who they speak to, and it's just, they don't have like the words to effectively communicate with people on the street. They don't all have the social skills to really talk to people. They don't know. And it's, I don't know, just simple. Sometimes the simple things you think are so simple are not, because humans jump to conclusions all the time. But that's a dangerous thing. So we really have to assess and reevaluate the policies that are about crisis, and they need to invite us to the table to be part of these conversations. But it's such an important topic. Even like a Taiwanese Canadian lawyer reached out to me in April on my way up to San Francisco. And he's like, can you help my Chinese Canadian family with their daughter who's at UCLA, who is in their psych ward, And it's just like, the family's willing to pay you. I'm like, wow. Wow. So this is a very small niche in our area, and I wish our society would talk more about it, but it's just like people don't know what they don't know until they know, until it's like big national news.
Thanks, Emily. Justin, Rob, do you have any thoughts on this sort of like, do these big national organizations promoting 988 so heavily? Do they know? Do they know the things you're talking about? And if they do, why don't they care? If they don't, how do we get them to know?
They know. They've known the whole time. They're the people who sponsored, funded, backed 988. They all work together. Often it's the same people moving around between these organizations. It's like I like going back to that core belief that I said that like we should save people no matter what. Like that sort of belief shows up across all of these organizations. And it's sort of coupled with the belief that people cannot make good choices for themselves where they're when they're in experiencing crisis, and that combination makes it so that people feel like it's okay to act on someone's behalf, and so like this is an acceptable part of the work to these organizations, and often they'll talk about how rare it is, how it's not very many people, and like that might be true, sort of, not quite to the degree that they say it is. And it is still someone's life that we are messing with every single time it happens. And I think that gets lost in these discussions.
Thanks, Justin. Of course, this is echoed in all the other advocacy issues that we have. I just met with the Governmental Accountability Office yesterday about so-called assisted outpatient treatment. It's kind of the same thing there. Well, it only applies to this really small group. It's a really high bar we've set. It won't impact you, so don't worry about it. And we have to save these people because they don't know what's good for them. Same theme across the board. Rob, did you have anything to add to this, or?
Yeah, and that's a theme we see throughout issues of involuntary commitment, forced detentions, and all that. Is this notion that, oh, it's so rare and it only affects so few people, and then whenever, wherever, and whenever we can get actual data, we discover actually America seems to be doing this more than anyone else on earth, and at increasingly high numbers for a really long time. And so this other narrative that's out there that's really rare and hardly affects anyone is fueling that. And so this is what, obviously, as Jess said, they know, absolutely know. Like I was on one of those FCC calls. I mean, I was just watching it like every other audience member, but Hannah Wesolowski from NAMI was on there and hearing various people, including people of color who'd been subjected to these kinds of forced interventions and having their calls traced and whatnot, talking about these as a really brutal, traumatizing experience, particularly affecting communities of color and on and on. And she heard all that and seemed to actually sympathize. She seemed to be kind of giving the same message to legislators, like, yeah, we need to be concerned about this. So I was like kind of hopeful. But now, she in particular, that's why I named her, is often the one being quoted in these news stories. And they did a survey recently that affirms this, that 86% of people who've never even had it happen to them say that it would not be a good thing to have that kind of a policing intervention happen. So they know that too, that the vast majority of the public does not want this to be happening. And it's happening, and it's happening in increasing rates. And she's not even flagging it, as near as I can tell. I got to say, I don't know, maybe she's trying and these media are ignoring her, but it doesn't seem, because literally it's nowhere. And I think that's all she would need to do is say, hey, this is a continuing concern, and particularly the numbers seem to be increasing, and we should be mindful. Like, I would just like to see at least a little care, even if they aren't saying, like I might say, you got to abolish this altogether, at least show some compassion and understanding and concern publicly and raise it and let people know, like, hey, if you're someone who's really concerned about this, you have the right to be aware and not make that call if you don't want to. But I'm not seeing that, and I find it very frustrating, and I can't explain why. Like I don't know. All I know is, wow, it can be right down to this person that I can see absolutely knows and is absolutely not telling the news media. And as I said, I was on a call with news media. I heard who else was on that call in some cases, and I know they directly did not write about it. And so again, we're going, all right, people are suppressing this. So it's not that they don't care in that sense. Somehow they're deciding we're actively going to not put that information out there. And I think it is this broader notion that, oh, 988, it just has to be presented as an unequivocally great thing, and I don't want to hear anything else about it.
Denial. And they also, I think, because 988, like SAMHSA has all these relationships with agencies, they're the ones who hold the money. And all my years of advocacy, they say, don't bite the hand that feeds you. It's almost
Yeah.
like children, right? Like it's like you can't say anything against their parents because they live under their rule. And so that's the power dynamics. And, you know, even being on the Californians against Proposition 1 team as the only full Asian on that team, it was like a friggin' David versus Goliath, right, Rob? It's like,
So,
yeah.
yeah. So before we move off this piece, because there's like another couple of paths I'm hoping to get us through over the next 20 minutes. But before we move there, do you think there's anything that would get through to people? Like people who feel motivated to suppress, who feel, is there something we should be focusing on that you can think of, a particular line of messaging or strategy that might actually get them to pay attention to all this?
Big, scary lawsuits.
That's a very clean, direct answer, Jess, that I think you're probably right. Yeah. Rob, do you have any other ideas?
Yeah, I mean, and like anything, if it happens to you and you happen to be a major journalist for a major news outlet or something like that, or a politician yourself, and this happens to you, you know, then I think we might shift the public dialogue. But it's something we're running up against. One of the theories I have right now around this is just that the buy-in around policing homelessness using mental health laws has become so powerful and so widespread around the country that nobody really wants to debate whether or not involuntary commitment is actually a good thing or not, right? They don't even want to have that debate because there's so much appetite for using this approach and claiming that, oh, we're not policing them, we're helping them, right? And so that's one of my theories. That's what we're up against, because even just 10 years ago, let alone 20 years ago, that narrative was not nearly as strong and big and prominent as it is now. It was there, but it's huge now. And so, you know, I look at that a little bit strategically. Okay, then if we could kind of break that narrative a little bit, maybe it would open up the dialogue around some of these other issues, you know. It's interesting that 988 is not getting any kind of critique right now, because even a year ago we did see, when it was revealed that Crisis Text Line was sharing some of that data, it was quite scandalous. And even the FCC wrote a letter to the FTC saying, you should regulate this, you should do something about this. So that got some traction, but now we're finding out that 988 is actually vastly worse than what Crisis Text Line was doing, and there's really been no scandalizing around this at all. So it's like the way in which we're building up immunity to, I guess, cultural immunity to caring about this stuff it disappears quite rapidly. So I don't have a great answer, but I do agree with Jess's suggestion. It would be nice to see some lawsuits that went at some of these issues. And I think regulators. So right now I'm looking at FTC. They may have some regulatory authority here, particularly with the corporations and private companies that are involved, because there's this legal gray area that where nonprofits exist, but definitely with the private companies, they have jurisdiction. And so maybe we can get them to wade into this space around 988 and go, hey, wait a minute, what is legal and what is not here?
Crisis Text Line is also the backup center for text and chat for, you know, like it's not even just that like 988 is, where it's like we know that all happened, people were upset, and now they have a contract, you know? Like
Exactly.
So one of the people on the panel, the American Foundation for Suicide Prevention rep on the panel yesterday, was saying, you know, we have to kind of give 988 space because they're in their infancy, and 911 also had all these bumps when they were in their infancy. But I guess I would think, in order to give something sort of the benefit of the doubt as it goes through some growing pains, it would need to at least be headed in the right direction. And I'm not getting the impression from y'all that this is just like growing pains. Seems like it's a fundamental foundation that is problematic. Is that Do I have that correctly from your
I just want to
perspectives?
say, I thought Jess addressed that really well early on here, right? Saying like the systemic changes that are occurring are actually making this a more profitable space overall, and that is really changing the color and tone. And that's what I'm seeing, like, wow, all those millions of recorded chat, text, and phone conversations and what I can do with those. You get out of my way. Like, we're talking unbelievable amounts of value there financially for these, and that's what they're seeing. It's like, I think the notion of help is just dropping off even the radar of the people really directing this. As long as they can kind of keep selling it to government, there's been $2 billion invested by government, and it's just all now just something that looks good publicly, and there's an enormous amount to be made. And then how this is playing out at that infrastructural level too. Like, I've already seen, like, hey, guess what? The same company that's running, or the nonprofit or company that's running the 988 call center and implementing the forced intervention, hey, guess what? When you're locked up in their space, they're the ones, they own the hospital. They own the instant crisis center as well. So we're seeing this overlap now. It's just, and also I will say that a lot of the dashboards that are being built, and Jess probably knows more about this than I do, but what I've seen from the outside is these dashboard systems that are built, they're being built already with this in mind. Like, hey, yeah, we're going to integrate people's electronic health records. So the moment you call, we can bring that up. We know everything about you. And of course, it's being sold as opt-in right now, but the tool is being built. And so they're already thinking about massive health system integration through 988. That's their vision. They don't care about the few people who are being involuntarily treated, because that's part of the system and how it works already anyway.
Right. So another piece, and it's very similar to what you're talking about, but it's slightly to the right of it, and it was one of the questions that got asked, like, are we likely to continue to see the erasure of local community supports, not just other lines, but even just other supports, because now we have this place to send people? Do you think that's going to continue to happen?
Yeah, like, so like the Medicaid requires people to have crisis services, and now they can just potentially use 988 for that, so they don't have that local service. As crisis systems evolve, they're going to swallow up other services to other levels of care, right? So we refer out to mobile crisis. So now anyone who's doing mobile crisis might, like, all of these systems are going to then build their mobile crisis teams, and then the respite centers, and then the crisis stabilization, all of that is going to get all of that stuff is going to come under some of these bigger systems. And as they do that, other things that do something close to or similar are going to run out of dollars, because it's going to come through government grants that maybe previously funded innovative little programs. And the grant is just going to go to these bigger things, and then you can't compete and you get starved out. And that's like sort of the way that the trend that I see happening already. I think there's if 988 is in its infancy and we need to be like, give it time to grow, we should be rigorously evaluating it, and that is not what's happening. I'm a career nonprofit worker. You always build a logic model and an evaluation tool, and that is not what we're doing. We're not evaluating 988, and it's by design. It is intentional. And like, some people might say, yes, we are, we're reporting all this data. I can tell you that is not a real evaluation. It's barely a process evaluation that the government requires for people to participate in this, barely. And that sort of lack of responsiveness by a system is dangerous, especially when it's designed to scale in the way that 988 is. So they don't have to respond to flaws in their system if they never ask what the problems are.
True enough. There are, of course, more questions in the follow-up questions about training, and we did talk about that a fair amount last time. Is there any change that has happened in how people are being trained, or even if we can access knowledge about how people are being trained, who's deciding, who's involved, any of that?
So training is definitely changing sort of rapidly all the time. The requirements for training are changing all the time. I know there's a lot of sort of dissent between providers and the Vibrant who runs 988 through the organization about like how that looks, what it's going to be like. I know they're forming some like peer support groups for call takers and stuff like that, which is an interesting approach and not necessarily bad, but complicated. So there's definitely evolution in that training kind of process. And just based on like having worked within systems like this for most of my career, there are going to be standards for training, but it's not going to be just full required training that sort of looks the same for everyone. There's some good and bad things about that. Um, I don't think we are ever going to be able to get to a point where people are trained effectively to manage the kind of crisis they might encounter on these lines, specifically because these are some of the lowest paid jobs in the mental health field that exist, and you can't afford to keep people, you can't keep people in that position. You can't afford to train them for the amount of time that they actually need to train. So like, it's always going to be a problem. And yes, there are changes and it's evolving all the time.
Right.
And I just want to add that, in fact, we're training artificial intelligence systems to monitor these calls and flag people for forced interventions and so on, to basically tell the call attendants what they should supposedly be doing, as if somehow a machine is going to know better than a human. And yeah, so that's the one training change I've learned about.
And Crisis Text Line was already doing that within their chat. Like they already had some of that system set up in their chat where it was identifying moments where you might want to ask certain questions. So that technology is all being integrated across. Yeah.
And that's where some of the sold data is going, right? To develop the AI. Yeah, that's terrifying, all of it. All right. And have there been any updates as to where you can access this information? I know, Rob, you've spent a lot of time looking for like, where do you get this information? Where can you get reports on involuntary calls, all that sort of stuff?
Yeah, I mean, the two articles I wrote recently for Mad in America are there for anyone to look at, and all the links to some of the sources. So people were asking about the PowerPoints and from our last call, and so all of that data there. The New Mexico data is there, the NRI study I referred to, all of that, the comments from EFF and Electronic Privacy Information Center, and yeah, other groups that are kind of becoming more aware of this and so on. So that, yeah, that's the best thing I could do, is just direct people to madinamerica.com and my name, Rob Wipond, and you'll find my latest articles there about 988.
Great. Now, some of the stuff that was in the questions in one way or the other that we haven't talked about, just like, where else can people go? And so one, are there other lines that people can call? Are there particularly lines that have cultural relevance or a focus in particular marginalized communities? I did make a note of some of them, so I'll just sort of list off the ones that I'm aware of, but I'm curious if you all have any additions. So there's the racial equity line out of Oregon that will take people's calls one time a day if you're not in Oregon. However, they absolutely will connect people to 988 and they will engage in active rescue. So there's that piece, but it does have that cultural focus, the race focus that is important for many people. The Black line, I was able to clarify they're updating their policy and removing the line that's on their website about reporting to authorities if someone is really in crisis. So that's what they're saying now, but they have these limited hours. Trans Lifeline now has much more limited hours, but they're absolutely committed to not calling anyone involuntarily on someone. Their hours have changed, though, I think to 10 to 6 Pacific, 1 to 9 Eastern most days. Of course, there's the Trevor Project for LGBTQIA folks, but they absolutely engage in active rescue and are working with 988. There's the We Are Native text line, and I don't know yet. Maybe you know if they engage in active rescue. I'm not sure, but they are focused on Indigenous communities. Then there's Thrive, which is very committed to not engaging in active rescue or involuntary acts, though I just spoke with someone today who said they might be committed in that, but at least the person that person had heard from when they texted was still speaking in these very, I want to help keep you safe kind of ways that are very reminiscent of those approaches. I'm curious what you all know of. Have you found lines that are really good or bring something that 988 is not bringing?
Well, you didn't mention yours, did you, Sarah?
No. Well, yeah, so the peer support line for sure that we offer there, and there's a few peer support lines. There's also the Oregon line that is committed to not calling anyone, for help involuntarily. There's certainly more than the ones I'm noting. In fairness, I was particularly looking at ones earlier today that were focused on specific marginalized groups. But the other thing I will also add is most of those lines, and certainly ours, have these really limited capacities. And they're probably, and some of them have grown more in the direction of limited capacity. In fact, when I called Blackline today to try and get some information, I got a text back that just said we're no longer 24/7, but it didn't even tell me when they are open. So I had to do some work to get there. And I'm just struck by the lines that are really trying to do the work differently have very little funding and are super stretched. And that's very much true of our peer support line as well.
Yeah, and that was what Jess was saying earlier, and that's what I've seen too. Like, we know from that NRSA that there are supposedly 344 call centers that are not part of 988. So who are they? What are they doing? It'd be great. I asked to see if I could get a list from them, but they would not provide it. But that would be a great thing to research, and really find out what are their policies, who are those other call centers, because they're at risk now. We know with all that funding that Jess was talking about earlier and how it's all working, they're going to get slowly squeezed out probably. And the only one I know, and it's not a specialized for marginalized groups, but Samaritans New York City does not trace calls, so they have that policy, but I don't know any others other than the Wildflower Alliance one that also doesn't trace calls.
We have to also do an analysis of is mandated reporting, because not everyone knows the difference between having suicidal ideation versus having an action plan. And so because this is so this topic is so controversial, it's just like, I think it puts call centers in on a like people who are considered mandated reporters like on a tough bind. And so, but
Yes, but we also need to make sure that people understand what mandated reporter means, because mandated reporter has nothing to do with suicide. The federal mandated reporter laws are around if you're aware of abuse to a child or a person who's over a certain age considered elderly or disabled, around, suspected neglect or abuse. And I think that the fact that so many people think mandated reporting is about suicide is part of the abuse and twisting of these systems. It's how they work. They convince people, oh, I'm a mandated reporter. Not only do I have these goals to save people, but I also have this federal mandate or state mandate hanging over my head, and it's just not accurate. So I really hope we can figure out how to keep changing that language, because there's that language, then there's the duty to warn laws, which do vary by state. And some of those duty to warn laws do apply to suicide, and some of them don't. Massachusetts, it does not. New York, it does, and so on and so forth. And people really have to do the work to understand that. And then it's, not even that, but yeah, are you the particular type of clinical role or other role that applies to the duty to warn? So there's a lot of layers there. And I think, it's up to many of us and others to make sure we keep pushing on the idea that it's a mandate, because the moment someone says it's a mandate, people are like, well, I can't question it anymore. Even if it were a mandate, we could still question it and advocate, for changing those laws. But the fact that it's not a mandate, usually it's just an organizational policy as to how people are expected to respond, that gives us a lot more room to question. So I appreciate you bringing that up, Emily, but we have a lot of work to get people out of that kind of mindset. It just cuts off our ability to push.
yeah, because recently I went to a neighborhood watch meeting where an officer was invited to do a presentation of how he he's supposed to be interacting with people who are homeless and having emotional crises. Like, he was telling one story where he was talking about how this lady in a situation was just casually saying like, oh, I could kill myself. And then he says, he just kept on saying throughout the presentation, better safe than sorry, better safe than sorry, better safe than sorry, because if you actually mean it, then, and you kill yourself the next day, that's on my, that's my liability. And it's just like, oh my goodness, like, because I was like thinking, man, I wish I could have had a conversation with this guy before he did his presentations, so he could understand from my point of view what he sounds like,
Right.
because he's never been in my shoes, so he doesn't know what I know.
So we're down to our last few minutes. Jess, it looks like you're unmuting for something.
I had just two very brief things to say. One is like, I think when we're thinking about advocacy work in this space, is that as a person providing services, you are in a very powerful position, and you can use civil disobedience strategies as a worker and not call cops ever, ever fucking ever. You don't have to do it. I have been a career crisis worker. I have never called the police in my career. You don't have to do it, and you can defend yourself about why. And so it would be beneficial for people who do this work to refuse to participate in coercive strategies because we know they're wrong, because we do. So you can do that. You can also recommend that as a supervisor. There are ways that you can be an activist within your organization around this stuff. And then the other thing is, like, I think there's a lack of people who want to do this work. That's part of why we are like why we're calling police and stuff, is that we don't want to sit in pain with people. So there's this bigger thing that's happening in the world where we're not learning how to be with each other through crisis. And that to me is like a scarier, bigger thing to address than anything 988 is doing, is that we are experiencing this loss of this really critical role in our culture of people who can help us through change and suffering. And like, if you are someone who can do that, finding ways to do that either in your community or in a professional setting is really, really important. We need people who do this kind of cultural work.
Thank you, Jess. And yeah, Jess, I'd love to talk to you, offline about, I think we're trying to start a series of inviting people to do little podcasts or webinars or whatever, who are talking about how they did the work differently or are doing the work differently. And so that idea of, civil disobedience from within your job, I'd love to do something around that. So I will be in touch with you about that. There are definitely other questions. I wonder, just like a couple of questions that stood out to me that are just maybe really quick answers. One is, do 988 calls typically have a time limit? I don't know if any of you know that. And then the other was, and I suspect the answer is a big no to this, like, does 988 have experience? Are they getting trained in talking with people who are multiple or diagnosed with dissociative identity disorder would be the diagnosis? Is that a thing? Because it's not usually a thing that people are getting support to have any real way of thinking about.
No, people are not getting at least with consistency, like any training on multiples or DID, and I would be very wary of what kind of training that ended up looking like too, just given the politics around it in mental health. So yeah, they're not getting that training. There's not supposed to be a time limit on calls, but that doesn't mean that people won't act like there is.
Fair enough. All right, thank you for those quick answers, and thank you to all three of you for coming back. It speaks to the fact that we could probably be doing this for another couple of hours and having good conversation of how much there is to unpack with this. But I really love ending on that kind of idea where maybe there is no way, or at least obvious way, to get through philosophically to some of the people who are leading the charge, but there may be other ways that we can explore around litigation and around civil disobedience within our roles. Because if enough people choose not to participate in it, it kind of doesn't matter so much what the organizations are saying we have to do, right? Like, if we can get that critical mass up. So maybe there's a whole nother way we can be trying to come at this, rather than just constantly wasting our breath trying to convince people who have real reasons not to be convinced, unfortunately.